Okay. All right, Miss Loretta. So we were just talking about your MRI, your back, and your leg problem, and you had gone to some doctors who wanted to do surgery on your back for your leg. Can you fill that in for me?
Yes, I had had a hip replacement due to a car accident, and after the hip replacement, I had a drop foot, and the surgeon who did the hip replacement had told me that I needed to go to a neurosurgeon or another type of surgeon, which now I can't recall the name. And I thought about it, and I thought, I'm a senior citizen. I do not tolerate anesthesia well, and what are my other options?
So they wanted to, you went to the other doctor and he did the scan.
Right.
And what did they find on the scan?
That there was pressure, not as a result of the surgery.
The hip surgery.
Right.
Okay.
Which I questioned, but I also know that sometimes, according to medical information I've gotten, senior citizens do have this as their age progresses, and it's pressing on the nerve, which is causing the drop foot.
Okay.
And it was recommended that I would probably have to have compression surgery.
Decompression surgery.
Decompression surgery.
Okay. And then you decided you weren't going to have that done.
I decided that reading about it and researching it, that was not an option that I believed in.
Now, who referred you here?
A friend of mine referred me here. She had been referred to you by another friend of hers that I didn't know.
Okay.
And she was in a lot of pain and had come to you and had good results.
Okay. So we've been working on, this is your fourth or fifth?
I think this might be my fifth or sixth.
Sixth visit. And are you seeing some progress with your drop foot?
I'm definitely seeing some progress. It's been slow but steady. And at first, I couldn't really tell how much progress I was making, but a couple of people mentioned to me how much better I was walking and how much more flexible I was.
And it is a process.
It is a process, and it's been steadily getting better.
Okay. Now, this is an important question. Did the neurosurgeon or the orthopedic doctor suggest this therapy? Did they put this on the table at all?
No.
So they didn't even mention it?
But I did go to a physicist.
A physiatrist?
Physiatrist?
Go ahead.
I'm not sure how to pronounce it.
Okay.
I had never heard of it before. And he told me that I had made the right decision not to have surgery.
Okay.
And he recommended an infusion. And I went ahead and I had that one infusion, and I did have some positive results with that. But then, with all the controversy over this, and when I heard about you and acupuncture, I mentioned to him, what did he think of that, and going for acupuncture, and he said, go for it. He said, I'm not sure how it works, but I know it works for many people, and is successful.
Okay, so you had an epidural. They did a spinal injection.
Right. Okay. He called it an infusion.
Infusion. Okay. So, thank you very much.